So there is a lot of interest around the world with flat feet. There is historical evidence that you could not be admitted into the British Army if you had flat feet and needed them treated. By far, for many people, flat feet may be a normal part of their development and not a problem. We generally classify flat feet into flexible or rigid flat feet, or sometimes I name them the good, the bad, and the ugly. The good flat foot is usually one with low arch. It's genetic. It does not affect the overall structure of your lower limbs. There is no associated tendon or ligaments problems associated with it. It is very flexible. And then there is the problematic flat foot. This is the one associated with hypermobility syndromes, where you're too stretchy. The foot and the ligaments and the bones collapse on weight bearing, results in torsional changes where you get internal hip, knee rotation. You present with symptoms such as foot fatigue, foot and ligament pain, knee pain, hip pain, lower back symptoms. These type of patients groups would generally be treated with rehabilitation such as physiotherapy, strength building, and supportive insoles, and wearing the correct type of shoes. Other types of flat feet are related to tendon failures, particularly the tibialis posterior tendon. The tibialis posterior tendon runs from the leg onto the inside of the ankle and inserts into the navicular bone in the middle of the foot. This tendon is very important in holding up the arch and stabilizing the foot during gait. It can fail due to either injury or generally is seen in patients after the age of 40 years old. Failure of this tendon gradually will result in flattening of the arch, stretching of the ligaments of the arch, secondary arthritic changes, and whilst it starts off as a flexible deformity in the early stages, it can eventually become more and more rigid and with increasing amount of pain and symptoms. Whilst all flat feet, even with tibialis posterior tendon dysfunction, should be treated with conservative management, which might include insoles, shoes, braces, immobilization, sometimes injection therapy such as PRP, or even steroid and immobilization if needed. Surgery is sometimes needed for more advanced cases where conservative treatment has failed. There are a range of operations that we can offer depending on individual circumstances, the findings of the MRIs, ultrasound, CT scans, or postural analysis. Surgeries involve resetting the bones, reattaching the tendons in the right place, tightening the ligaments. A combination of these procedures are generally required. Sometimes we need to perform major fusions of the feet to stabilize, especially in the more heavier patients or patients with arthritic changes in the joints. There are also genetic conditions which are seen in the young adolescents from the age of 9 to 15. They are known as tarsal coalition. This type of rigid flat foot does need treatment because they often present with pain in the teenagers. Teenagers will often come in and tell us that they do not like to do sports, where in fact the problem is their feet hurt. The mesenchymal cells, the cells that separate during the wound, fail to separate in some of the joints in these patients. And this results in increased rigidity and bone synostosis, where the bones are essentially joined up, so they do not separate into separate joints. And this results in a more rigid flat foot. If you do have a flat foot, you will need an assessment. We will assess your gait, your position standing. We may request a range of blood tests or scans to ensure that we get the correct diagnosis. But don't be surprised if you have flat feet, whereas most flat feet are quite benign and can be easily fixed without surgery. Should you require any advice or treatment, please do contact our clinic and we will assist you as best as we can.